Welcome back, everyone. Joining us now is Dr. Janelle Dua to talk about the critical gaps in the healthcare system when it comes to women's metabolic and hormonal care. To start things off, can you tell us what your research shows and what it means for all women?
One of the greatest findings that we had in our research was that women are accessing GLP-1s and hormone replacement therapy kind of in unprecedented ways. But what is really missing is that follow-up, and follow-up that includes a comprehensive, holistic plan that not only thinks about prescribing and prescription refills, but also about the woman's lived experience, her nutrition, her exercise, resistance training, mental health. Half of women that take these sorts of medications, GLP-1s and hormone replacement therapy, find that their follow-up is lacking, that it's inconsistent, it's inadequate, and really not meaningful. It's not helping them to understand how these medications work, how they may be working in their bodies, how to optimally and safely use these medications. So we've kind of unearthed this gap where there's access to prescriptions and women are getting these medications, but not really understanding how to use them well and use them optimally.
Tell us more about the results you saw in your research.
Yes. So another place where we wanted to focus, one of the biggest things that we have found in our research also is that not only is the traditional healthcare system kind of broken on the part of the patient having to navigate siloed appointments where a woman is unsure if her symptoms are related to each other, if they are just random, how to get help in understanding and connecting the dots. The other flip side of this is that we have our providers who have said in our survey results that 20% of them also feel this keenly, in that they admit that there's a training gap where they don't feel comfortable or adequately trained to, especially in the realm of menopause care, but extrapolated to women's health as well. So we're seeing unearthed by our research that there is a deficit in how women are followed up for their care when taking these very important medications. And part of that may be why, due to providers really feeling inadequately trained to manage the concerns for which women are coming to them. And I think that this is where Maven is bridging that gap. We are a hub where women can come, they can feel heard, they are listened to. We are, our providers, and I say we too because I see patients as well, are actually asking those deeper questions, getting to the root cause, understanding the woman's lived experience, and how to create a personalized, individualized, comprehensive plan for that woman that can work with her lifestyle. And we have providers who are passionate, experienced, and have expertise both in GLP-1 and metabolic health, as well as hormonal health. So we're meeting women where they are at with our expertise, with their lived experience, and creating individualized, comprehensive plans for them that actually work.
Where can our viewers go to find more information and start bridging this gap?
Yes, so your viewers can check us out at mavenclinic.com/care, where they can look at our GLP-1 offerings and our hormone care offerings and see if it's right for them.
Thank you for joining us today on Studio 4. We will have another great show filled with great guests tomorrow. We will see you then.